Love this group home. Every time I go there, it is some place that gives me some satisfaction in terms of how the patients are being taken care of or being treated. So I've been seeing this patient, and he was diagnosed with Parkinson's disease. He also has a diagnosis of hypertension. So he has been on nifedipine for a while now. But every time I see him, he's always complaining of dizziness. Sometimes he'll have some falls, and the falls are not to the point where he, sustained any injury. So his EKG was fine, labs were looking fine, but I wasn't so sure why he was having all of this, dizzy spells and all, because of his high risk for falls, with the fact that he has the Parkinson's disease. Blood pressure trends for the period that I've seen him were pretty good, and previously, he's been with the practice for a while, so his blood pressure trends are pretty normal. So I was like, all right, then it could have been the medications that are, causing his blood pressure to be normalized, which is what you want and what the goal of the treatment is. Or it can be a case where, there's something else going on, why he's having the dizziness. So I said, all right, then we're going to put a hold on the blood pressure medication, see how his blood pressures are, given the fact that he's been consistently, on the lower side. And he says that rather than taking, like, say, the 10 of nifedipine, he's taking, like, say, 5. So I was like, no, let's just go ahead and hold off on the blood pressure medications for a while because of the frequent, dizzy spells, lightheadedness, and near falls. So today I went in and saw him, and he has a fractured ankle. So I'm like, what happened? He was getting out of bed, and he thinks his blood pressure was low, and he literally went down. He didn't hit his head, thankfully, but he has a fracture to the malleolar bones of the right leg or the right foot. So he's supposed to be seen by like an orthopedic specialist and all. So, but the good thing about it is that at the time when I had seen him, because of the dizziness, he had seen his cardiologist as well, and the cardiologist had discontinued his blood pressure medication. They didn't want him to be on any more blood pressure medication, but at the time I had stopped him, which was good. So because sometimes it takes 3 months to get into a specialist, or 2 months to get into a specialist. So it was good that I had stopped the medication at that time and have him just being monitoring the blood pressure at home. So we had him on blood pressure monitoring to see what his trends were looking like, and his trends has been pretty good off the medications, which was pretty decent. But yeah, so that was it. So with him now, he's a high fall risk. He's always been a high fall risk because of the dizziness, the Parkinson's. So, we just have to make sure we're keeping an eye on him as best as we possibly can. Because the one thing you don't want is for these elderly folks who are on so many medications already to be having episodes of dizziness, and then to be having fall. And then because he has a history of Parkinson's disease with the tremors, it's just like more risk factors for him. So when I observed the home was fine. There's not much clutter or anything, he has this cane that he walks with every now and again, so I try to encourage him to make sure he's using the cane at all times, educate him on the importance of the boot, and especially the fact that he saw an orthopedist and they didn't think he needs surgical intervention. That boot is going to be very important, so I explained to him and all. So he went ahead and got the boot, and I put it on for him so that way he can constantly wear it. But the only time I encourage him to take it off is whenever he's getting a bath, because it's going to be difficult for him to have one foot outside of the bath and try to be taking a shower. Or I tell him that he doesn't need to take a full bath, but whichever one he prefers, the most important thing is that he's safe. So yeah, so that's it with him. So I'm going to go over to see this other lady in this group home. And I love this group home. Every time I go there, it is some place that gives me some satisfaction in terms of how the patients are being taken care of or being treated. The setting, when I get there, I'm going to show you what the home looks like. I'm not going to take you inside because I'm not going to invade their privacy, but the outside, I'm going to show you what driving in looks like for that home. But yeah, it's so beautiful. There are probably about 4 homes on that property, and they're all assisted living. Each home houses, I think, about 30 persons, they said. 30 persons are in each home, and when you walk in, it is like you have a big open area, so it's an open concept with a living, dining, kitchen. And when you walk in, it's a big table that is there that all the residents, they show up and they will eat breakfast and lunch. There's a common area that they'll go and sit and watch TV. There is they have individual rooms, so none of the patients are sharing rooms, so all the rooms have their own bathroom, and they have their own bathroom and their little space. So it's really nice. Oh, I'm gonna use my other phone to give you a view of what it is. Driving down there. All right, so this is what the time looks like right now. Okay, so all right, so yeah, so the home is very, very beautiful. This is the best home that I've visited. When I talk about the place is clean, the residents looks happy, the resident look happy, and everything from the food that they're cooking, it smells good. The place smells clean, it's well taken care of. And so when I go there, I just wish that, you know, every one of the home that I visit would kind of have this appearance and make the residents comfortable. But you know, some persons have their business and they provide a service that they're able to afford, and so you know, that's about it. But I tell you, this residence, so they have 1, 2, 3, 4, I think it's four properties. So straight down there is a property for the patients. Oh, there's no parking space here for me, but okay, I'm gonna go to this one. I'm gonna park right here. But this is one house. This is really, really nice, and this is just a concept that I will steal when it's time for me to create my own, you know, home where I'll be housing residents and taking care of them. That's a plan in the making. All right, so I'm gonna go in and see this resident. She's a sweetheart. She has osteoarthritis and some other conditions as well. For her, she prefers to have a regular primary care provider orders her medication for her, because she is still with her primary care provider. So even though we see the patients in the home setting, not all the time they give up their primary care provider. They also still sees them because they feel a little bit more comfortable, because some of them have their providers for like 10, 15, 20 years working with, so they know them. So for us, it's just going in to make sure that if there's anything that they need that their primary care provider is not able to do, because some of the primary care providers, they're not able to do the home visit, and so they recommend different services for them to go ahead and do the in-home visits for them. So some of them do keep their primary care provider, and we see them on a monthly basis just to make sure everything is fine. But apart from that, you know, I'm going in to check with her. The last time I referred her to rheumatology because she was on like so many medications and all, and we weren't able to manage her pain, so she wanted a rheumatologist to see her. So we did that, and the family is going to arrange for, you know, transportation to see the rheumatologist. But apart from that, you know, everything is fine with her. So I'm gonna go in and see her, and then I'll be back.